Jones. Right now, we have more than 1,400 Oklahomans in the hospital, leaving only about 50 adult ICU beds available in our entire state. News Channel 8's Maureen Ward spoke with a local ICU nurse about what she's seen over the last 8 months. Maureen?
Tulsa has been in Tier 2 of the state's surge plan for about a week now, and that means 15 to 20% of all the patients in the hospitals have COVID. And that constant pressure is exhausting for healthcare workers.
A little bit discouraged that sometimes it feels like there's no end in sight.
At 30 years old, Lizzie Bradford has seen more than most. She's been a nurse for 8 years, but it's the last 9 months where she's experienced more tragedy than all her other years working combined.
More often than not, it's the nurses that are in there with them when they're dying. So that has happened a lot of times in the last 9 months.
How's that been for you?
It's hard.
While she's learned how to better care for COVID patients while working in the ICU at Hillcrest, she says the virus is still unpredictable. 1 minute, someone's fine, and the next, she's a stand-in chaplain or a family member for someone who's dying.
Especially emotional, I think. It's very emotional to be with someone in those last moments and then, call the family and kind of tell them, what happened and that you were there with them.
When we spoke in July, Lizzie had hope. At the time, things seemed to plateau, maybe even slow down a bit. But then October came and COVID cases began to surge.
At some point, there's going to come a day when people need ICU beds and we don't have them. So that's definitely something that is scary and honestly has kept me up at night.
She says there's a battle going on in the hospitals. Beds are filling up and they're doing everything they can to fight a virus that keeps winning.
We're going to get to the point where we all just need a break. But we're not going to get it. It's just going to keep getting worse. And so I think that's the fear we have.
Now, Lizzie says one of the things that is so difficult for her is when they get off their shift and they come out in the community and they don't see people wearing masks. She's asking folks to please wear a mask because it'll help stop the spread of the virus and help give these healthcare workers a much needed break. Reporting live at Hillcrest, Maureen North.